Imagine a single statement causing a pharmaceutical giant's stock to plummet and reigniting a decades-old debate about autism. That's exactly what happened when Health Secretary Robert F. Kennedy Jr. hinted at a potential link between Tylenol use during pregnancy and autism in children. But here's where it gets controversial. Kennedy's upcoming report, expected to be released this month by the Department of Health and Human Services, HHS, suggests that acetaminophen, the active ingredient in Tylenol, along with low levels of folate, vitamin B9, might contribute to the developmental disorder. This claim has sent shockwaves through the medical community and beyond, leaving many parents and expectant mothers questioning what they thought was a safe, over-the-counter pain reliever. Tylenol, a household name for pain and fever relief, has long been considered safe for pregnant women. The American College of Obstetricians and Gynecologists, ACOG, even endorses its use, albeit with a recommendation to consult a doctor. However, Kennedy's report challenges this widely accepted stance, drawing on existing research to argue that acetaminophen could pose risks to fetal development, and this is the part most people miss. While some studies have hinted at potential dangers, others have found no connection, leaving the scientific community divided. Kenvue, the parent company of Tylenol's manufacturer, was quick to respond, emphasizing that the report is based on speculation. In a statement, they reiterated their commitment to safety and pointed to the U.S. Food and Drug Administration, FDA, and leading medical organizations, which continue to support acetaminophen's safety during pregnancy. They also advised pregnant women to consult healthcare professionals before taking any medication, a prudent reminder, but one that does little to quell the growing unease. Here's the kicker. Kennedy's report isn't just about Tylenol. It's also expected to revisit the long-standing controversy surrounding vaccines and autism, a theory Kennedy has championed for years. Brian Hooker, an ally of Kennedy and chief scientific officer of Children's Health Defense, hinted that the report will likely address vaccine components as well. This dual focus adds another layer of complexity to an already heated debate. The timing of the report has raised eyebrows, too. Studies into autism's causes typically span years, yet Kennedy's findings seem to have materialized swiftly. An HHS spokesperson defended the process, stating they're using gold standard science to investigate America's rising autism rates, now diagnosed in 1 in 36 children. But skeptics wonder, is this thorough science or a rushed conclusion? The fallout has been immediate. Kenvue's stock dropped 9.4% following the initial report, its lowest point since August 2024. Meanwhile, Kennedy faced scrutiny from senators over his recent actions, including the mass exodus from the Centers for Disease Control and Prevention, CDC, and his stance on vaccines. As the son of Robert F. Kennedy and nephew of President John F. Kennedy, his words carry weight and controversy. Now, the big question, is Kennedy onto something groundbreaking, or is he amplifying unfounded fears? The report's release will undoubtedly spark fierce debate. What do you think? Is there a connection between Tylenol, vaccines, and autism, or are we jumping to conclusions? Let's hear your thoughts in the comments. This is one conversation you won't want to miss.